Come in. How are you doing today? Good. So, are you here for a cranial nerve exam? You are, brilliant. So if you could just confirm your name for me and I'll check you are at the right appointment. Perfect. Okay, so I already have all of your details on file. We are just going to ask a couple of general health questions, if that's okay, before we get started. Okay. So first things first, is there any concerns you have? Anything been bothering you? Any aches, pains? Okay. Okay, and are you on any medications at the moment? Right. Have you noticed any changes in absolutely anything? It can be from eyesight to taste, smell. Okay. Do you wear glasses? Do you have a prescription? Do you have any hearing aids or anything? Okay. Is there any family medical history I should know about? Any high blood pressure, diabetes, heart conditions, absolutely anything that, runs in the family? Okay, are you a smoker? And do you drink alcohol, and if so, how many units a week? Okay. How would you say your diet is? Are you quite healthy, or do you have a lot of junk food? In the middle. Yeah, well, we do say everything is okay in moderation, so as long as you do have obviously a good balance, you do want more healthy foods, but the odd treat now and then is fine. And what about exercise? Do you exercise regular or no exercise at all? How many times a week? Okay, that's brilliant. So you'd say you're generally quite a healthy, fit person. And I do have obviously everything on file, but could you just let me know how old you are, just so I can... Perfect. So that's all I need at the moment. Yeah. Are you comfortable, first of all? Brilliant. So I'm just going to pop this down. First things first, I'm just going to pop some gloves on. Now these are latex free, so even if you did have an allergy to latex, which I know you don't from your file, but this would be fine. Pop them on. We actually have black ones at the moment, which is maybe a little bit weird for a doctor, but we ordered the wrong colour, so black ones it is. I mean, obviously you're probably used to seeing the blue or the clear or creamy white ones. But... Okay, so now I have my gloves on. I just want to ask if it's okay if throughout this exam I get a little bit closer to you, and am I okay to touch your face? Okay, brilliant, thank you. First things first is I'm actually just going to take a listen to your heart, okay? So I'm just going to pop this in. I have weird piercings all over this ear, so it's a little bit tricky. There we go. So I'll just warm this up so I don't give you a shock. you okay to just lift your top up ever so slightly or pull it down just so I can get... Brilliant. Okay, so I'm just going to come in and take a listen now. So if you just breathe normally, so in through the nose, out through the mouth, just as you normally would. Obviously don't try to breathe any different if you think that it's what we're looking for. This needs to be as natural as possible. Okay. So deep breath in. Okay, we'll come over here and again just breathe normal. And now take a deep breath in for me. And out. Okay. Once more over this side. Take a deep breath in. And out. Okay. So that's all we're going to do there. Obviously, if we don't hear anything, any crackling or anything, and if you're saying that you have no issues, we just leave it there. That all seems fine. Okay. So the next thing is I'm just going to literally be taking a look at your face. Sorry if this is a little bit awkward, someone just staring at you, but I'm just kind of looking around for symmetry and to see if you have any cuts or bumps or rashes. I think everything from sight looks fine. Just taking a look down your neck. Okay, so that all looks okay. Now I am going to come in and be feeling around, so is that okay to do? Okay, so just look wherever you want. There's no process to this. I am just going to be feeling around your face. Just please do let me know if at any point you feel anything at all that is uncomfortable. And let me know if it doesn't feel the same, like on both sides. That feel the same. Okay. So everything feels pretty good here. You've got no pain at all. Brilliant, that's what we like to hear. So, okay, I'm now just going to feel your neck, okay? Feel around your lymph nodes. They don't seem to be swollen or anything, so that's good. I'm just going to ask if you can take a big swallow for me. Brilliant. And one more time if you can. Brilliant. And can you just cough for me? Just, I know it's annoying, but just kind of force a cough. Okay, that's perfect. Again, that all feels fine. Okay, so I'm now just going to ask you to close your eyes for me. I'm going to take this cotton wool. I'm just going to swipe little bits of your face. And with your eyes closed, I just want you to say, feel it, or yes, when you can feel me touching your face, okay? So close your eyes for me. Good. 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 Okay, and I'm now going to take this again so you know what this feels like, and then kind of a dull, you'll feel a dull touch to your face. It's not sharp, but you will hopefully be able to distinguish the difference. I want you to close your eyes again for me, and then if you can just say either soft or sharp. We'll call this sharp, but obviously it's not going to hurt, it's not sharp, it'll just feel less soft than this. So, okay, so let's go now. Close your eyes. Good. 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 Brilliant. Brilliant. Good. Good. Yeah, perfect. So that was all, again, absolutely fine. No worries there. Okay. So what I'm going to ask you to do now is, this may be a little bit weird, but it's fine. I'm just going to ask you to pull some different faces, and I'm just going to examine and see if that is all fine. Just let me know again, any pains, but you shouldn't feel anything with this. So first things first, can you give me a big cheesy grin? Okay. And can you frown for me? Okay. And can you puff out your cheeks like? Can you pout? Can you scrunch your forehead up together? Okay, and can you suck your cheeks in? That's lovely. I just want you to clench your teeth together now. I'm just going to have a feel, okay? And open. And clench them together. And open. Okay, lovely. Okay, and now what I'm going to do is I'm just going to take a little look in your mouth, if that's okay. Obviously, you'll need to see a dentist if I do find anything, and if you have regular dentist appointments, this should be fine, but we just take a look kind of at your gums and the inside of your mouth. So if you could open wide, I'm just going to take a little look with the mirror here and a light, okay? So if you can just open, and we'll take a look inside. So okay, it all looks a healthy colour. Have you had any toothache recently? Okay, your gums look fine. As do your teeth. You have lovely teeth actually, so well done. Okay, like I said, that is nowhere near in depth as a dental exam, but we just take a look just in case we happen to see anything. But again, you've passed with flying colours. So moving on to the olfactory nerve, we just have these little pots, okay, covering up the scents, because I'm actually going to ask you to smell it and then just let me know what you can smell. So let's start with our first one. Okay, and just take a smell. And what can you smell? Lemon. Brilliant. Okay, so let's grab another. Ooh, this one's strong, you can probably smell it already, but you just have a little smell of that. Coffee, yeah. Perfect. And then let's do the last one now. Okay. Take a smell. 3, correct. So yeah, that's all we're going to do on your olfactory nerve. You identified all of the scents straight away, so no issues there. So I'm now going to move on to your optic nerve, okay? Now this is obviously the nerves in your eyes. So first things first, once again, I'm just going to do a simple examination, taking a look in your eyes. They look quite even. Can't see any redness or watery eyes. Okay, so I think the first thing we will do is we will read the eye chart. Now I'm just going to hold it because we are a bit further away from the wall, so to make it fair, I will hold it up, and all I want you to do is when I point to a letter, if you just read it to me as best you can, obviously. Okay. Right, okay, so nice and easy, we'll go for this one. Okay, and this line. And this line. And this line for me. Perfect. Can you cover your left eye? And can you just read this line for me, please? That's brilliant. And now can you cover your right eye? And can you read this line for me, please? Okay. And now with both of your eyes uncovered, can you just read the lowest line you can? Fantastic. Can you just give this line a try? I know it's a little bit difficult, but we're just going to see if you can get any. Brilliant, that's fine. So you did pretty well on that, no concerns. Yeah. I'm just going to make a note of where you could read to. Just so I can pass that on, so we can see if your eyesight is any worse next time. Okay, so I'm now going to examine your pupil reflexes, okay? All I'm going to do is I'm going to be shining this light in your eyes. It may be a little bit bright, but it shouldn't be uncomfortable. Again, if it is, just let me know and I can stop at any time. Okay, so you don't need to do anything. You can just look in my eyes, look at the wall behind me, look at my nose, anything. So I'm just gonna be okay. Brilliant. So this side now. Okay. Okay. I'm just gonna do it from different angles now. You're doing great. Just one more time. Okay, now that all looks fine. So I'm now just going to be taking a look in your eye. I'm not looking for reflexes this time, I'm just looking Okay, that's brilliant. So we'll leave the light now. So now what I want you to do is I just want you to cover one eye. So you'll be using only one eye. So the eye that you cover up, that one. So I'll be taking this hand. I'm just going to wiggle my fingers, okay? And I want you to let me know as soon as you see movement. So just say yes or now. Okay, so eye covered. Just going to bring it up here. Good, and I'm just going to bring it down here. Okay, so if you cover your other eye up now, we'll use this hand. Same again, same procedure. Again, I'm just going to move it up here. And down here. Okay. How was that? Okay. So now I just want you to look. You can uncover both eyes for this one. Look straight at my nose. I'm just going to be moving my hands further outwards, and I just want you to know when you can no longer see them. So stare straight at my nose, don't follow my fingers or anything. Okay. You ready? Okay. Good. 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 Brilliant. And now, the final part of me looking at your eyes, because everything seems fine. So what I want you to do is I want you to stare at my nose for me. And then when I say, I want you to switch to staring at this hand, okay? And then I'm just going to see kind of your reaction. Okay. So, nose and hand for me. Back at my nose and stare at the hand. Brilliant. Stare at my nose and back at my hand. One more time, nose and hand. That's perfect. So everything with your eyes seems absolutely fine. Nothing to worry about there, so we'll now move on to the next part. So I'm now going to move on to your ears, okay? I'm going to come round to each side and just be feeling them. I'm going to shine my light in and take a look, and then we're just going to do a mini hearing test, okay? Okay, so I'm just going to come round to both sides and just take a look in your ears. Okay, so starting on this side, just shining my light in, and seeing if I can see any redness, any swelling, or dry or oily patches. I'm just going to pop the otoscope in your ear, okay, so you'll feel it now. let's come round to this side now. Okay. So again, just shining my light in, looking for any redness, any sore spots. Again, everything looks fine this side. I'm just going to enter the otoscope in this one. Okay, that's brilliant. That all looks perfect. What I'm going to do is I'm going to be making noises like that. I'm going to start both sides, and I just want you to let me know when you can no longer hear those noises, because I'm going to be moving outwards, okay? So, are you ready? Okay, let's do it again. Perfect, and I just want you to say left or right when you hear the same noise, okay? Brilliant. Brilliant. Good. 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 Both. Okay. So the last part on the hearing, I'm going to come back round to either side, and I'm going to whisper some words, numbers, phrases, anything that comes to mind, and I just want you to repeat whatever I say. Okay, so I'm going to come round to this side again first. Okay, so are you ready? Chocolate, flowers, 16, light, trigger, exam, perfect, love, 56, gloves, phone, microwave. Okay, that was brilliant. I'm going to do the same over this side. So exactly the same again. Purple, 64, bed, music, happy, deodorant, 6, 28, cranial, relax, sleep, tingles. Okay, so yeah, everything with your ears and your hearing seems perfect, eyes perfect, facial nerves perfect, sense of smell perfect. Now I do just have to ask, is your sense of like taste, is everything tasting the same? You're not having any kind of metallic taste in your mouth or anything? Okay, good. So we don't tend to test that. I just like to ask because I feel like you'd know straight away probably if that was the case. So we're literally very close to the end of this exam now. The last thing I do want to do is just kind of do some like resistance exercises with you. Okay, so if you just sit comfortably, I'm going to pop my hands on your shoulders. I'm going to press down and I want you to shrug your shoulders, okay? So, go. Push up. Perfect. And now with them shrugged, I'm going to try and push them down. I want you to resist. Brilliant. Okay, so I'm now going to pop my hand on the side of your face here. I want you to push against. So, push. And this side, I want you to push. Brilliant, that's really strong. I want you to hold your fists out like this. I'm going to try and keep them strong. I'm going to try and push them in. Okay, so now I'm going to come in between. I'm going to try and push them out. I want you to resist again. Okay, that's brilliant. I think that's all we're going to do for today because I can see you're pretty strong. So let's take my gloves off. I'm just going to check my notes, write a couple of notes down. Just check we haven't missed anything, okay? So I'm just going to grab my notepad. Okay. So how are you feeling now? Is everything okay? You're not feeling any discomfort? Any pain? Any tenderness? You haven't gone particularly like itchy anywhere? Okay. So we've done your face symmetry. Felt around, you've pulled some faces. You've done sensation on your face. We've done your optic nerve. We've done 2 hearing, and that was all perfect. Everything in your mouth looked fine. And you was really good with your accessory nerve. You managed to resist all of my tests. So, sign this off. I'll photocopy this into your file, and should you need access to it, you can just ring up and ask. But as there is no issues that I have found today, you're free to go. You don't need anything else, no further appointments or anything. So I will suggest coming back once every year, just for a checkup, just to see that nothing has gone drastically downhill or anything. But yeah, it was absolutely lovely to see you. Yeah. If you need anything, just don't be afraid to give us a call. We can help. Okay. Have a lovely day. Bye.